Hi, my name's Taylor. I'm going to be your nurse today. I just have two injections to give you. One is IM, so in your muscles, and the other one is sub-Q, which is inside of your skin. I'm just going to go over your MAR quickly to make sure that everything's correct. So I'm just going to double check. Your name is Mario Mancini. You have been diagnosed with congestive heart failure and you're allergic to codeine. Is there anything else that I should know? And is that all? 8 right to medication, so the right patient, the right medication, the right time, the right dose, the right route, the right reason, the right position, and the right documentation. The medications that you're going to be given today are heparin, 5,000 units per 1 milligram vial. And this, based on my calculation, translates to 1 milliliters of the medication. And then your intramuscular one is going to be Haldol, which is 4 milligrams per 2 milliliters in an ampule. And based on my calculations, this is going to end up being 0.5 milliliters of the medication. I'm just going to assess the patient's body build, muscle size, and weight so that I know the appropriate needle that I'm going to use, the length and the gauge. So we don't have a patient here right now, so I'm just going to so if you had a patient with a bigger body build and who was a little bit heavier, you would need to use a longer needle size because you would have more tissue that you would need to get through, and same with muscle size. If the muscles are bigger, you might want to consider using a needle that's a little bit longer so that it can get fully into the muscle. And then on the other side of things, if you have a patient who's really skinny or has muscle atrophy, so a decreased muscle size, I would consider using a smaller needle because there isn't going to be as much to get through. So for sub-Q, the length ranges from 9.5 to 16 millimeters in length. And then the gauge of it is going to be 25. That's pretty standard. Most needles, or most of the sub-Q needles, go by 25 gauge. We're going to use a 1 milliliter syringe because that's how much medication we need. And then for the intramuscular one, this is usually pretty standard, about 25 millimeters in length, and the gauge is set at 23, which is pretty standard for all of the muscle injections. And we are going to use a 3 milliliter vial, 3 milliliter syringe, pretty much because that's the only thing that we had here today. But if I had my own choice, I would go down to a 1 milliliter one because you want to be as accurate as possible, so you want to have as little sections that you're going up, so you want to have as little volume as you can. I'm going to start by opening the needle. Next, I'm going to take an alcohol pad, and I am going to open the medication label, and I'm going to take the alcohol pad and I'm going to rub it for 10 to 15 seconds. I am going to take my needle, and since it's already assembled, I don't have to assemble it or anything. I'm going to so I'm just going to pull, and I'm going to place this facing towards me on my table. Next, I'm going to take the syringe and I'm going to draw back the amount of medication that I want. So this is sub-Q for the heparin, and it's going to be 1 milliliter, so I'm going to draw it back with air to the 1 milliliter point, and then I'm going to take it and I'm going to stab it into the vial. I'm going to push the air into it, which is going to create a negative pressure, and it's going to draw the syringe to come up with the medication already in it. Or not. That's okay. I'm going to tip it over and draw out the amount of medication that I need. I'm going to try not to get air bubbles because air bubbles aren't good things. Okay. So I'm going to flip it over, bring it out. I'm going to hold it upside down. I'm going to try to flick to get the air bubbles to the top and out. So now you're going to prime it, and I'm going to be careful that I only prime it up to what I need, which is 1 milliliter. So I'm just going to hold it out sideways and push up till there's no air left. Perfect. So next you want to recap this because you're going to draw up the IM. So you're just gonna slide it along the bottom, pick it up, and push the tip back on so you hear this. I'm going to take a piece of tape and just write that it is heparin on it and the amount. And I'm gonna sign my name, and then I don't have tape, but I would tape this to the syringe so that I could remember. So I'm just gonna put it underneath, put it towards the top. Next, I am going to perform hand hygiene, just in case you have any sort of medication left on your hands. You don't want that to transfer into the next needle. So I'm going to do proper hand hygiene, get all the germs off. Next, I'm going to assemble the syringe for the IM injection. So I'm going to open the package, again being careful to leave it in. And as you can see, this comes in 2 different portions. So you're going to assemble it first, leaving the cap on. So all you do is put it on, screw it in as tight as it can go because you don't want it to come off or any medication to leak. And now this is all ready for you to use, so I'm just going to place it back down. We're going to use an ampule, so you have to break the top off. There's a little blue line here that's going to show you where it's going to break. So you want to make sure that you have all the medication in the bottom and no medication in the top. And you're going to break away from you because you don't want the glass to come near you. So it's broken. Since it's glass, it's going to go directly, the top of it directly into the sharp spin. For ampules, you don't have to create a negative pressure because there's no lid on it that's going to keep a pressure in there. So you just got to make sure you drop the right amount of medication. This one is going to be for Haldol, so we're going to need 0.5 milliliters based on my calculations. So again, be careful when you're pulling it off that you don't come back. You're going to get down, put it in, be careful not to touch the bevel, and draw up your medication. Alright, and I drew up a little bit extra again this time. If you have extra, it is, especially in an ampule, because it's just going to get wasted. It's nice to drop a little extra to ensure that you have enough. I'm going to flick to get all the bubbles out. Once all the bubbles are out, I'm going to prime the line up to the right amount of medication that I need. Perfect. So again, this is on the bottom. You're going to drive it in, kind of like a race car. Put it on the top and snap. I am then going to write what the medication is and sign it so that people know whose it is. The leftover thing from the ampule is going to go directly into the sharp spin. I would go in, and in St. Joe's they use Dovetail, so I would scan his arm bracelet and ask him his name and his date of birth to confirm who he is. Sub-Q, we're going to be giving heparin, and it's given in the stomach or in the leg because these are the most fattiest parts of your body. We're going to give it into the stomach this time, but say a patient had incisions all over the stomach, you might want to consider giving it in the leg. It's given with a needle at a 45 to 90 degree angle. IM injections can be given in the arm around the deltoid, or in the front of the thigh or the back of the thigh. IM injections are always given at a 90 degree angle. So we're going to do sub-Q first. I'm going to hand hygiene again, just to make sure my hands are all clean. So we're going to start with sub-Q, and looking at my patient, or my pretend patient, we're going to say that they are of a healthy weight, so we're going to put it into their stomach. When giving an injection, you want to support the skin. So if your patient is overweight, you might want to spread the skin a little bit instead of pinching so that it goes all the way in. But if the patient was of a less healthy weight, or even like a normal healthy weight, you would support the skin by doing a minor pinch so that the injection can go right in. So like I said, we're going to give it to them into the abdomen. So we are going to take our medication. We're going to check again the dose because you just want to make sure. So we're going to check that it's 1 milliliters of heparin, especially heparin's an anticoagulant. Take a alcohol swab. Take it out. And we are going to rub the site of injection. Next, we're going to let it dry. It's dry. We're going to uncap our needle. When you're giving the injection, you don't want to hesitate. You just want to go for it when you're going because it hurts. So I'm going to support the skin a little bit at a 90-degree angle, sub-Q 45 to 90. You're going to watch and you're going to push it in. Once it's in, support, push in, push all the way in, and you're going to take it out. With some injections, you will rub an alcohol pad after, but with heparin, you don't. Right after, directly into the sharps container, we're going to do the IM one. I'm going to do the deltoid, which is the one in the arm. So when you're doing the deltoid, you're going to feel around for the acromion process, and you're going to palpate. It's about here, just tip of your shoulder. And you're going to palpate 3 fingers down, and this is where you're going to give it. If you push on it and you're an adult, you can actually feel the pain from being given so many medications. So I would have palpated down. I'm not going to do that, don't have a patient. I'm going to, again, use an alcohol swab, take it out, rub the site of injection for 10 to 15 seconds. Okay, let it dry. So you're going to uncap. Same thing, this is an IM one. So you're going to support the skin with a teeny pinch or a stretch. Right in at 90 degrees, into it, inject, make sure it's all in there, pull out. And like I said, this one has a safety feature, so before you put it into the sharps container, as soon as it comes out, it's going to flip up and it caps the needle, and then still directly into the sharps container. Next, I'm going to take off my gloves because I don't need them anymore. I would do some hand hygiene, ask the patient how it went, if they're feeling okay.